in digital marketing, being able to see the full 360-degree view of our communications with patients and what we're doing. And at the end of the day, it's going to create a better experience. So really kind of marrying, what we're doing with data and, some of our projects and stuff, and really aligning it with the experience that we're wanting to our patients to feel and to see when they're coming to our organization, I think has been essential, because you can't just live in this silo where you're thinking about tools and, making things efficient and stuff. It's how is this actually helping the everyday person who's actually coming in, and not just what we think, but how can we actually validate those things and utilize surveys and talk with our patients to say, is this really going to make a difference?
Well, that's Ashley Anderson, Director of Digital Marketing at Adventist Health. Ashley has pioneered digital marketing across some of the West Coast's most prestigious health systems for nearly 2 decades, building comprehensive social media programs, managing crisis communications, and leading editorial and digital media teams. Ashley's been an up-close witness to the complete transformation of digital marketing in healthcare. From the early days when simply getting approval to use social media in a hospital was a challenge, to today's complex landscape of HIPAA compliance, AI-generated content, and privacy-first data strategies. In today's conversation, we explore how Ashley creates authentic connections in an age of AI-generated content, why privacy-first data strategies actually improve performance, and how healthcare marketers can transform regulatory challenges into competitive advantages. I'm Aaron Burnett, and you won't want to miss this episode of The Digital Clinic.
You have a lot of experience in brand strategy and content strategy and digital marketing overall, but I noticed that kind of the through line is a lot of social marketing strategy.
Mm-hmm.
And so I'm quite curious about a couple of things.
Yeah.
One is how you think about how you create authentic connection in the world of TikTok and AI and, 6-second attention spans.
I really think that it does start with just making sure you do the work ahead of time to make sure that you're comfortable with the material that you're sharing, right? And that's one part of it. But I think it's also just like being true to yourself, being true to the time, being true to the question, and just bringing your most authentic self and leadership and all those other things kind of to the table. And for storytelling, it really is the same, because it's those really fine moments of connection where you can say, oh, I see that in myself, or I know that I can relate to that. Those are the things that are really going to touch and move the needles. People remember how they felt, not necessarily just what you said. So bringing that authenticity is really how you can touch the feel part of a person, rather than just the logical brain side of folk.
Well, you have a long history of doing that sort of thing in other organizations. And I know we were just talking about the fact that you're good at this yourself, but most people are not. And so how do you work through other people? How do you get other people to behave in an authentic way, to produce content and connection in an authentic way, when the instinct when the camera goes on is, I need to sit up, I need to speak with perfect diction, everything needs to be very professional, none of which is particularly authentic.
It really is just the balance of those things, right? And making sure your subject, whomever you're talking with, is feeling comfortable with you as an interviewer or whatever environment they're in. I feel like that comfortability is really what really clicks and really allows people to bring their most authentic selves to whatever story we're telling or whatever health information that we're giving. And spending a lot of time with providers and different folks, it really is important to understand who they are and try to connect to that before you jump into actually filming and really getting them comfortable with you so that they can just spill everything to you when they're talking.
When you approach filming with someone or creating social media content, social marketing content, do you have a recipe that works? Do you, for example, one thing that occurs to me is maybe you overshoot. You need 2 minutes, but you're going to shoot 20. And you're just looking for the good 2 that are mixed in there. Or do you start filming before anybody knows you're filming? Or do you leave the camera running afterward to try to capture authenticity? Those are all things that I have tried, and some of them work sometimes and some of them don't.
Yeah. I mean, like you said, some of them work and some of them don't. I feel like really just getting to know them as a person, asking those, prior questions, those pre-interview questions is super helpful. But just really trying to connect, and open yourself up. I share my story as well and share those kind of tidbits with folks when I'm working with them. There's no real magic recipe. I just really try to go into the situation and whatever story I'm telling with what's that final message? Like, what's really going to resonate? And how can I ask the questions that will get to this kind of content that I'm looking for? I'm thinking about like webinar videos or, bios and things like that. It's what are you trying to get to at the end of it that will help you understand what questions, what things you need to do as you're interviewing, as you're filming.
You're in a new role with Adventist Health.
Hmm.
You're director of digital marketing.
Hmm.
You have been in other strategic roles with other healthcare systems, and you have developed strategies for other healthcare systems. How is the strategy that you're employing for Adventist Health different than what you might have done for other health systems, particularly given how much the technical environment and the social environment has changed over the last few years?
I feel like the biggest difference, at least for me, is I've always really been in the academic space, in the more urban city areas. In my role with Adventist Health, I'm really reaching out into more of the rural areas of California, some of the less populated areas. And so it really does take a different mindset, a different mind frame, because people who live in rural areas do not operate the same as folks that live in the city. And being able to connect to both of those things, because I'm from not rural for Nebraska, but Nebraska, where it's vastly different from living in, Southern California. I can bring kind of that background and nuance and understanding because, I've lived it. My family continues to go through it as they live in rural Nebraska. So bringing those strategies and really kind of reframing has been like the priority and really kind of the biggest difference between some of my previous roles and this role, which has been really exciting.
What's your span of responsibility in this role?
In my role as the director of digital marketing, I'm overseeing our website development and creation and enhancements, really working with our marketing automation team and the CRM, with our analytics team and really making sure that we're getting the data and the insights that we need. So there's a few kind of teams, and then as well as reputation management, so reviews and all the online search kind of functions and tools. So anything third party outside of like an internal digital tool is really kind of my sphere of responsibility at Adventist Health.
How has the rise and increasingly restrictive nature of privacy regulations changed your approach to both digital marketing, but also more importantly to measurement, to knowing what the heck is working and where to find your audience and how to optimize?
I feel like my background in social media, especially at the beginning of social media, has really been instrumental in all of my roles because it really had to deal with dealing with, compliance and risk and legal on an everyday basis, getting them to even approve the use of using Twitter in a hospital. So I'm really, really knowledgeable about the nuances of, the policies, HIPAA, the compliance aspects of it. So that unfortunately was something that I've brought to this role and has been super helpful. But then, so the data side of it, it's really been more about the connectivity between those data sources and how do you make sure that they're talking to one another so that you're really digging deeper into the more complex, analytics that are really going to get you to the next wave and not focusing just solely on those more vanity, high level metrics, but how do you create more complex ones that will really show you the effectiveness of the different tactics that you're doing in marketing?
Given the expansion of the definition of PHI from HHS at the end of 2022 and the effect that that had on third-party tracking for advertising and analytics, what is your approach to measurement? What is your approach toward developing and maintaining and protecting a source of data truth?
Just really going back to the basis and the foundational work of what it means to be compliant and being secure and having the policies, the retention policies, the data understanding of, who's looking at your data, what you're using that data for, and really, creating the documentation around that, I feel like has been really essential in like making sure that we're compliant, secure, and that they're not just things that we're doing now, but things that we're continuing on throughout the next things that we build, the next tools that we're bringing on. So it's not just like governance and compliance as a fun little blip because this ruling has changed, but it's more about how are we weaving this into every single thing that we're doing so that we're making sure that we're being extremely safe with, the sensitive data that, sometimes is passing through our analytics.
We work with lots of healthcare systems and other folks in medical device manufacturing. And kind of our consistent refrain is around data around performance optimization and tracking, and even around data strategy, right? You need to take control of your own destiny and not rely on third-party tracking, third-party performance reporting, third-party audience targeting, much of which is, I think, pretty clearly a HIPAA violation, although some of the case law isn't settled at this point. Even if it's not, it certainly puts you at risk.
Mm-hmm.
How has the shift away from, I know different organizations have a different compliance posture. Some on the sort of laissez-faire end of things have said, well, it's kind of unsettled. We'll take the metapixel off, but we'll let the rest ride. And others of our clients went lights out on third-party tracking until we could implement a HIPAA-compliant data solution for them. How has that evolution away from third-party tracking and third-party targeting affected your marketing? And do you still have the same fidelity around what works and what doesn't?
I mean, I feel like we're still all kind of like figuring it out, right? But I feel like the tea leaves were on the wall a long time ago around privacy and around compliance and safety, right? Like there was definitely a sense of feeling like, Cambridge Analytica way back in the day, those kind of mentalities and things that happen with data. There really was a priority and a switch to thinking about how do we make sure that we're maintaining this data? How do we make sure that it's safe? Because we obviously can't trust other folks, right? So, how do we make sure that we're putting in those processes, procedures? How do we make sure we're having those conversations and creating that roadmap? Because, as we've seen, things have changed over time. And just because we're doing it one way right now, like literally, there could be something that's handed down tomorrow and things will need to drastically change. So, how do we try to minimize the risk and feel comfortable with the things that we are all right living in the gray around is really kind of been my approach is where are the things that we want to, be risky about? What do we really want to maintain our safety around? And, where is that fine line in between that we can play and experiment and innovate because we do need that kind of safe sandbox to play in.
AI has been a part
Mm,
of your strategies.
mm,
I would assume is still some part of your strategies today.
mhm.
How do you think about the use of the implications of AI for digital marketing and I would say in particular for content marketing in the healthcare space?
We're all still kind of figuring it out, right? There's a lot of opportunity there, and I feel like we're all kind of seeing where AI can definitely help in that or that content creation, but I feel like what is still kind of unknown is how everyone's going to respond to it. If we're all using AI to create and develop content, aren't we all at risk of, having the same kind of content and it really not helping anyone? So how do you balance, really stepping into content creation with AI in a tactful and mindful way so that you're making sure that you're still maintaining the uniqueness that is needed to make sure that you're grabbing those AI search results, you're, coming up in those results because, it's going to be increasingly more and more difficult. And as we lean to AI for help, I think that it's a great partner, but there still has to be some guardrails and some guidelines around it because I feel like things will continue to shift in this space. And I don't know how comfortable folks are with reading just straight AI content rather than it being something, nuanced and special just for you.
All of this is changing so quickly that I could tell you sort of what's happening today and it will all have changed tomorrow.
Mhm.
But I was reading an article in the New Yorker that was juxtaposing two different contexts for AI. One is specially trained LLMs that were focused on medical diagnostics that were highly effective. In fact,
Mm.
more effective than the physicians against which they were competing in most ways. There are still shortcomings, but in most ways, very effective. I think coming up with the right diagnosis much better than 90% of the time, which was better than the human diagnosticians against whom they were competing. On the other hand, consumer use of, in particular, ChatGPT to get medical information has increased dramatically over the last couple of years. A majority of people, and I think this was something like 70% of the people polled, said that they had used and some regularly use AI to get medical information. But the researchers also found that medical information was inaccurate about 2/3 of the time.
I remember talking to physicians, and they'd be really upset about patients coming in because they already consulted Dr. Google. And they already found out, what Google said I have. And so they came in and, it was just a hard and awkward conversations at times because, Google gave them the answer, right? And the same thing, like you're mentioning with AI, is the same kind of challenge. But I think about the opportunity in that because with having these large LLMs that are able to parse through the data and find the specificity and the nuances that maybe the humans can't find, the diagnostic folks can't find in that moment, and being able to like layer on, your actual patient data at some point in time, or actually having your physician participate in your chat on GPT. Like how incredible, and how that could potentially change the way that we're treating and, practicing medicine by leveraging these models and AI. I mean, it's exciting and exhilarating and very scary at the same time, but I feel like there's a lot of opportunity, and I think that things will dramatically change in the coming years.
We've talked a little bit about data strategy, and so I have two related questions. One is, are you working on developing and deploying private LLMs that can use data and be trained on data that is isolated to a particular healthcare system or even patient set?
Not that I'm aware of and involved in quite yet. There's just been some kind of ideas and kind of brainstorming going on what possibilities are. I know that we're exploring some opportunities with our chatbot and making sure that it is really utilizing the content from our website to make sure that it's, obviously populating the most accurate answers possible. That's kind of the most of it now. I feel like there's also a lot of opportunities, not just on the patient side, but on the marketing side, where we're able to, use agents or deploy other LLM models on top of our data sets that will then show us and populate insights from our website use or from, some of our marketing campaigns. So I think there's a lot of different opportunities. It's just which one's the best for us at this moment in time.
So I'm curious about this as well, because there is a lot in the zeitgeist, a lot of discussion about agentic AI.
Mm.
Are you at the point where you have developed and deployed agentic AI to support your digital marketing? Or
No.
that's what I thought. My sense is everyone's kind of there. Still playing with it, could be true, seems like it should work. Haven't really deployed it in production, particularly in sensitive industries like healthcare.
Yeah, I've only been playing with that kind of functionality more so on like a individual basis. And right now I have like some little agents that are crowing and crawling on various channels, obviously, to give me the latest information about privacy updates and, the different judgments that have been held down, because it's just, there's no centralized place. So how can I create other agents for myself or for my team that might be helpful in other minutia that like, just a little thing, but it could be so helpful.
Yes, and you are in arguably the trickiest state in the country for privacy with regard to healthcare.
Yeah, yeah, but it's a fun challenge I like to have. We're kind of setting the tone here in California. So if we are in other markets, in other states, how the privacy policies have changed and kind of evolved since other states have been adopting them. So I'm glad that we're in California and we're kind of on the cutting edge of some of these policies and stuff. And I know that we just passed a new AI policy too. So excited to kind of dig in more for that and to see what that will mean for us later down the road, because they're fast and
Yeah.
furious now.
California is, sort of with regard to how advanced they are and also how restrictive privacy laws are, kind of the GDPR of the US. If you can satisfy the California standard, you're generally good in all of the other states in the same sense that's true of GDPR.
100%. But it's also
Yeah.
like, in Oregon, they have special call outs for geolocation that we don't necessarily have here in California. So just kind of managing those things and like, how do you do it? And then it's also interesting to see how vendors are responding to this, right? Because, they're not necessarily wanting to build things just for one client. But if everyone in California is needing the same type of thing, then are you providing those mechanisms? Like DSAR requests is a really big component where like we need to have those platforms be able to be audited and, skim this data to be able to fulfill these requests. But some of these platforms aren't even caught up to what the new legal standards are. So it's been a really interesting journey through everything.
Particularly with regard to the platforms, they're kind of in two different camps along the continuum. Three. There are some that are just sort of stasis, not responding to anything, not really changing or evolving. The large platforms, I think, are responding preemptively. And regardless of whether federal guidance around privacy regulations is unsettled in particular ways, they are changing data policies and changing audience targeting policies and tracking policies so that certain data is just not available to you if you are in a sensitive industry. You can't target in certain ways if you're in certain industries. It doesn't matter what the law says. We're just not even going to touch an area of potential risk. So I think that's interesting with regard to privacy regulations. Regardless of what happens legislatively, the industry is changing and will, by definition, then change marketing practices.
100%. I mean, even like when I'm talking about vendors and their platforms and tools, but I mean, just how they're operating. Like, it's interesting to see now. I feel like there's been partnerships and new alliances formed in this space in digital marketing that haven't existed before because they were more of competitors, but because the space is evolving and changing from privacy to just the technology, there's now these new opportunities that are arising because of it. So it's an interesting, interesting time.
It is. I'm very interested in the opportunities you see because our experience is the same. When we work with our clients, we take them to an operational reality of full HIPAA compliance. So we implement HIPAA compliant data strategies and a HIPAA compliant data warehouse and all sorts of other things. And the concern as we began to do that with clients, and it was a concern on the client side, and honestly, a little bit on ours as well, is that by definition, when you become fully cognizant of and compliant with privacy regulations, you lose fidelity in third-party platforms. You lose the ability to target audiences in what was the easy way, and you lose easy tracking as well. And the worry was, okay, if you lose all of that, then maybe you also lose efficiency and you lose clarity with regard to what works and what doesn't. Our experience has been the process of going through that implementation and becoming more thoughtful and more rigorous about the true moment of value creation and actually optimizing for that, which probably doesn't exist in third-party tracking. It probably exists in an EHR or a CRM or something like that, drove really significant improvements in performance and efficiency. So the opposite of the thing we feared happened, but it was quite hard to get there. It takes a lot of work. I'm interested in the opportunities that you're seeing and what's been realized.
Being able to see the totality of what, the efforts are being done, right, in digital marketing, being able to see the full 360-degree view of our communications with patients and what we're doing. And at the end of the day, it's going to create a better experience. So really kind of marrying, what we're doing with data and, some of our projects and stuff, and really aligning it with the experience that we're wanting to our patients to feel and to see when they're coming to our organization, I think has been essential, because you can't just live in this silo where you're thinking about tools and, making things efficient and stuff. It's how is this actually helping the everyday person who's actually coming in, and not just what we think, but how can we actually validate those things and utilize surveys and talk with our patients to say, is this really going to make a difference, or are we wasting our time with this one thing that we think might be really efficient but might not actually satisfy, what a patient might need to make their experience even more streamlined.
Bringing together all of those touch points so that you have a holistic view of the patient experience is very tricky. We've helped some health systems to do similar things. How have you done that?
I still haven't. I mean, we're still in the process of it. And I feel like right now we're really in an interesting opportunity just with a new implementation of Epic. And so we're able to really bring all the players to the table and think about the operational readiness of everything and the data structures, and really be able to focus on, what are we trying to achieve? So I feel like with this Epic implementation and all the tentacles that it's touching from there, it's been really the key piece to like bringing all these pieces together and really thinking about the total experience, and not just as a function of marketing or a function of IT or some other, department. It's all, how are we looking at this together, which has been amazing.
We have worked with Epic through the years as well. And I know that historically, Epic was a fairly closed system. They didn't have a lot of incentives to let anybody else in. This new world seems to require a level of interconnectedness just to maintain marketing efficacy. Has Epic become a little more open? Are they more flexible, more amenable to working with others than they have been?
It seems to me to be that way, at least from where I've sat in Epic implementations along my career. It, like I said earlier, it definitely seems like there's more interest in partnering with other players to kind of bring things together to let and leverage, the best think less technology and work processes and, technology to really to do what you're needing to do. And so like one opportunity I'm thinking about is just Press Ganey, and how they're really partnering with Epic to really make, their product even more, enhanced than it already is.
I am curious about content strategy and social marketing as well. What do you measure that demonstrates the value of the work that you do?
It's a lot of top level metrics, if I'm being honest right now. We're really working to get to a more sophisticated level of things, but we have been able to lean on our metrics to really show the importance of the right content, right? And really making sure that we're focusing on those right pieces of content at the right moment, telling those patient stories that are really going to change, brand perception and get people interested in our brand and coming and visiting our providers. So it really right now has been about utilizing that data to make sure that we're creating good things that we know are getting lots of views and visibility and people are responding to.
You've done many interesting things in your career. There are a couple that jumped out at me. One is that you are a published research author. You were part of a study on using YouTube to get information out around men's health and how effective or not effective that was. How did you come to do that? What were the results of that study, and what, if anything, has happened since in that area?
That was a project I worked on a really long time ago with a really engaged urologist and a men's health physician. And he was really passionate about talking about issues that you wouldn't commonly talk about at that time. And this is almost like 10 years ago. But it really was about, talking about, topics for men that weren't being talked about and how can we push that out. And at the time we were working on a webinar series that I helped to produce. And so we focused in on like a couple of segments of videos and really tested out and wanted to see, who was looking at these and were they impactful. And we found that these videos had astronomical views for Peyronie's disease and all kinds of different issues. But because of that, we saw that this was a platform that was being consistently used by males in particular to get their information. And so it was really interesting to think of YouTube as a different platform at that time when we were just thinking about uploading videos, but it really was a significant channel and still is to this day for getting content and information out there. So that's what that fun study was. And the researchers did it. I just happened to be a part of it to provide the information and the insights with the rest of the team as well.
So how has that informed your strategic perspective through the years? I would assume that video has become an even greater facet of what you do.
It's still relatively hard to produce an amount of good video content very quickly and at scale. That's always been the challenge at every organization. But, with AI, who knows what kind of opportunities are available with it. But video will and always be a really important media in this space. I always think about video as the platform, where are you trying to use that video that's really going to make the most impact? Is it TikTok? Is it Instagram? Is it Facebook? It really depends on what you're trying to accomplish, and thinking outside of the box has really been kind of the key takeaway from that whole project is, it's not always what you think it's going to be.
So I'm a husband and I'm a father of 2 daughters. The lack of seriousness and the lack of information and engagement around women's health is surprising to me. And really frustrating to them. Right? The questions that they might ask a physician and the I don't knows they get, where it seems like you should know and you should also care, is frustrating. I'm curious to know if you have a perspective on whether that's changing, what will drive the change, whether that will get better.
I mean, there's so many pieces here. I feel like social media has allowed, more and more women's health topics to rise to the surface. But I feel like women's health is where it is because of the lack of visibility and funding and research and all of the other systematic things that have been done to not prioritize women's health. Because we
Right.
are complex bodies and creatures, and our bodies are just different, and we need a different level of expertise and care. And I think that it gives me great hope to see how this has kind of changed over time because, as social media started talking, we're hearing more about menopause and that being a thing. And so, the more and more people are bringing, attention to these topics, the more and more money and funding will get, put into women's research that will really elevate it to where it should be.
Yeah, I'm seeing that. I think as well. I certainly see it anecdotally in my own life. For example, I belong to a group of company founders called Entrepreneurs Organization. And the Seattle chapter has about 160 members or so.
Mhm.
As with lots of entrepreneurial groups, we're probably 85% male. But somebody suggested that there should be some education on menopause. And a whole lot of men said, I'm super interested in that. That's a factor in my family. And as a matter of fact, it was a majority of the men saying, yeah, that's an important topic, and there is a lot of information out there on it.
Like you said, men are now interested in menopause, right? Because like for a really long time, and maybe this is still true, but I'm feeling like I'm starting to kind of shift my way of thinking that, women are the chief health officers of your family. And I do believe to some extent that will always be sort of kind of true. But it's been really interesting to see how men have then come along in this journey and get, interested in understanding menopause or women's bodies or birth control or all the different things because all of those conversations have been elevated more. And I'm just so happy and proud that more and more women are speaking out about these things because it is significantly underfunded and it really does need more visibility.
It's a crazy dynamic.
Right. But then I think about like breast cancer research, right, where it has gotten significant funding and as it should, right? But like breast cancer is only one component of the many complexities that women's bodies go through, right? So it's like, how can we switch it from just, breast cancer research to ovarian to, menopause to, fibroids and endometriosis. So it's just there's so many other topics to dive into. So there's a lot of opportunity.
All right, if you project forward, let's say 2 years into the future, what do you think digital marketing for healthcare looks like a couple of years in the future?
Well, I definitely think that, AI will be more of a thing. It'll definitely be more of a tool that everyone is using to build content at scale and, utilizing it there. I mean, technology is going to continue to advance and change and evolve. So I feel like those kind of strategies around your MarTech stack might change and evolve because I'm seeing more and more proprietary platforms that are popping up that are trying to solve multi, problems in one solution. So I think you'll see even more of that and maybe some consolidation there. The digital landscape is constantly changing and evolving and things are done differently and it'll be completely different how we do and treat healthcare in the next couple of years, I think.
So I've been in marketing for almost 30 years now. And, digital from the first moment that the internet was a thing. So almost 30 years as well. This certainly is the period of most rapid, most tumultuous change that I've ever encountered. Do you enjoy this level and this rate of change?
Yes, to an extent. I mean, I definitely feel the same way. I joke all the time that this feels like when social media first started and the same buzz and electricity around the tool, like it feels the same. It just feels amplified by like 2000%. So everyone's chasing after, a new shiny toy and AI agents here and AI agents there. So I feel like, really making sure that you're, sticking to what's going to be actually helpful and not just in concept, but how do you test things out over time? Pilots will be increasingly significant. I'm in digital because I like the complexity and the change of it constantly. The volatility of what things are right now feels a little bit strenuous, but I mean, it's got to be part of the fun to live and breathe in this digital world for sure.
It is the first time in my career where I thought on any given day, I'm not sure whether I'm ahead or I'm behind or just where I need to be. And that changes moment to moment with the new big thing that is announced or the 10 new big things that is announced on any given Tuesday.
Right. Well, and then, I just heard, a month ago there was another acquisition and merger of platforms that we utilize. So I'm like, well, how is this going to change things as more and more folks are kind of change, their offerings. So, I mean, there's so much change. There's so much momentum. It's really hard to not get just like, golden retriever style and wanting to look at everything about everything and just really trying to stay focused on your end goal, which is, improving the patient experience, because that's truly what I live and breathe in this space for.
I've really enjoyed the conversation.
Me as well.